To me, this means a second chance.
How you all got into this industry yourself.
I'm 14 years in recovery. It was very messy prior to that, and it wasn't pretty. And the biggest gift out of all of this is that I get to help other people on the road to recovery.
I don't have a problem.
Right.
This is who I am. I only drink, I only drink one bottle of wine a day.
That's right.
I have patients that are on high doses of.
Yes.
There's a stigma, regardless, and this disease of substance use disorder does not discriminate. These people who are addicts or alcoholics are the dregs of society. Well, they're not.
But once our brain gets hijacked, that's when we lose our objectivity.
Was the most important part of my journey. The only thing you have to change is everything. Yeah.
Mind your health. You got to mind your health. Mind your health. Treat yourself. You got to mind your health.
Hi, and welcome to Mind Your Health. Mind, medicine, mouth.
Muscle.
I love that. 4 pillars of Mind Your Health. Dr. David Berg, thank you for joining us today. We have some wonderful guests here on Mind Your Health. Victoria Berg, thank you. Lisa Michie, it's great to see you too.
Thank you.
Coastal Oaks Recovery. I said Discovery. Coastal Oaks Discovery and Recovery is absolutely wonderful. Because we have a lot of listeners who are curious about what the word recovery means. Let's really start there if we can, Victoria. What does the word recovery in this sense mean?
In the substance use disorder treatment facility world, to me, this means a second chance. It means you can change what the past was and recreate yourself and have a better future.
And let's talk a little bit, Lisa, if you will, about Coastal Oaks specifically. And you're brand new.
Yes, we are.
I shouldn't say brand new, but you are relatively new and already have quite the reputation. It is superior for doing not just substance abuse recovery, but you also do some dual diagnosis things. Share a little bit about that with us.
We did. So I'll start with, I love what Victoria said about recovery, and recovery has multiple components and lots of layers. Coastal Oaks Recovery is a 72-bed substance use disorder treatment center that offers medical withdrawal management, so detoxification services, driven by providers, physicians, nurse practitioners, psychiatrists, pharmacists, a multidisciplinary team of people who are licensed to be able to care for those patients safely. Secondarily, we provide residential services, which once you get through that medical withdrawal management and your brain is not on fire from having chemicals in it, you're able to make some of those psychological and behavioral recovery changes that are so necessary to set you up for long-term sobriety and recovery.
One of the things that we pride ourselves is really educating the population at no cost about things like recovery, things like mental health, correct?
Yes.
And I'm just curious how you all got into this industry yourself. Do many people have personal stories? And do you mind sharing a little bit about that?
Okay. So I'm 14 years in recovery. I'm an alcoholic in recovery. I won't ever be recovered, but as long as I work my program and from everything that I've learned along the way, I will maintain my recovery and live this much richer and fuller life. It was very messy prior to that, and it wasn't pretty. It involved little visits to the jail, to DUIs, various legalities and things like that. Not being the best mother in the world, which breaks my heart, but I'm here now 14 years later showing them that I can do this, and I'm going to continue doing this. And the biggest gift out of all of this, along with being able to be present for my family and my children, my grandchildren, is that I get to help other people on the road to recovery. And that would never, ever had been in my remit 15 years ago when I worked a whole different world. And to me, that's it. It's life-changing. It's something that I'm proud now. And you can, I think part of the act is you find your value. I feel
So you live out your core values now. It's funny, I just had someone talk about when they were on this side of the fence, it's so hard to imagine the healthy side. And now that you're on the healthy side, actually, I think it was you two talking. Now that you're on the healthy side, you can't imagine you know.
And when you're on that other side, you don't always realize you're on the other side.
So that's where I was going to go. So I see a lot of people with a lot of issues, both drugs, alcohol, other issues. That if you mention to them, oh, gee, you know, you may want to consider a program. They're like, I don't have a problem. This is who I am. I only drink, you know, I only drink one bottle of wine a day. I only do my oxycodone because, you know, I'm in pain.
Right.
They don't understand how harsh and how destructive some of that behavior is, and how there is so much of a better life. How do you gently encourage? Is that the right word? Or, you know, because I'm not a family member. I don't want to be confrontational, but I mean, I have patients that are on high doses of strong stuff. And I totally get pain management. I get issues. But
Well, we're not judging any of it.
yeah, that's right.
Exactly
We know what we don't know.
We're all talking about this word stigma.
Yes.
There's a stigma, regardless, and this disease of substance use disorder does not discriminate. It doesn't matter
Right. If you're
money you make, if you're a mark, if you own a $2 million or a $5 million or a $2 place to live.
Right.
It does not discriminate. So there's no precursor to that. And so there is this stigma that over the years in our society has pushed it further and further that these people who are addicts or alcoholics are the dregs of society. Well, they're not. They're no means of society.
I say
People with thriving lives and thriving careers. Yep, but they're ready to crumble.
Yeah. And also, never have I met anyone who has a substance use or a co-occurring disorder who said, you know, David, I really want to screw your life up. And I want to screw the rest of my family's life up. You know, I don't really want my to be married. I don't really want my work. No, we don't say that at all. But once our brain gets hijacked, that's when we lose our objectivity, I think.
And I think that Victoria touched on it, you mentioned it. It's the behaviors around addiction and the substance use disorder and the depression and the anxiety that create the stigma that this person is bad trying to good. They're not bad trying to be good. They're sick.
Correct.
And to get well, and hence, how do we take care of our mind and our body at the same time?
I had someone say to me the other day, I really want to get better. I want to get better.
They know it's there. Yeah.
Not so sure, because I'm a little apprehensive about what it will look like.
It changes everything.
Yeah.
There's a statement and with amongst people in recovery that the only thing you have to change is everything. Yeah.
Well, and that could be a little, for viewers.
People don't like change.
That's right. For listeners out there, they're like, wow, I'm into this. And then you're like, wait a minute, I have to change everything. How do I even begin to do that? Where do I start, Lisa?
Well, and you can start or just making a courageous decision to say, I'm going to try treatment or I'm going to try to see an outpatient, but I'm going to talk to my pharmacy friend. It is not this huge leap off the side of a cliff, even though it feels like it. It's one tiny baby step in doing something just a little different.
But I'm scared if I tell you, then you'll know, and my secret will be exposed.
You took the words out of my mouth.
Did you hear what she said?
I already know.
Okay. You already know.
And everyone who loves you and supports you knows, so let us help you make that little change.
Yeah.
But I thought I was so good at keeping this private. That's
I thought you were keeping it private. And that's part of the reality is just the acknowledgement and the validation that no matter what you say to me, there's no judgment. If you had cancer, I would not try to talk you out of going get your treatment. You would not want to try to talk me out of going to get your treatment. That's no different.
That's a good point.
And if there was a reoccurrence, we would all rally around you to get you back to your health, to normality.
Am I afraid of change? Am I afraid of failure? Am I afraid of what?
I think the difference, I think we're all afraid of things, but it's walking through the fear and realizing that when you get to the other side, recovery gives you your choices back. Yeah. That's the beauty of recovery, because you like everything's going to change. Yeah. And I always tell people you can reinvent yourself and live in your possibilities.
Yeah.
I think the whole topic of recovery is so interesting. We've talked about it before because it's not necessarily just substances. It can be food. It can be gambling, it can be pornography. It can be a lot of different things. How did you get into this field?
Well, it's funny because that's a perfect segue.
We're professionals.
I can appreciate that. You right there. So I think it can be anything. It can be an anxiety with trauma that now you grew up in a great environment with lots of support, or you grew up in an environment with no support, but your coping mechanisms to deal with those things may not have been the healthiest at the time you were facing them. Yeah. So my recovery journey has all of the parts and pieces, but it came through kind of perfectionism and a disordered eating. And therefore I use stimulants to maintain that. So you see a lot of that secondary or tertiary piece of how does a person get to, where they think they're in control of everything. Well, being in control of everything is not as enough to do all of that stuff. I maintain just a balance.
I think you brought up a great point, and I've seen it now in my 2-year-old grandson. What's the new one?
Like rescuing?
Snow. I think the new word is. Well, that was the helicopter parents. The new one is snowplow parents. We're moving every obstacle further, so the kids got. Well, that's not reality. That's not life. And we do as a society, I think, my personal experience is we don't do a good enough job teaching children how to deal with life. Life is not fair. Life is hard. You're not gonna get every job. Not everyone's gonna like you. There's this, and try to tell, it's like trying to teach a teenage boy not to drive fit.
Right.
They just don't get it.
Do you know what it's called in the psychological world? It's called learned helplessness.
Yes. So it is. Yeah. I just read that article.
Mark Seibelman writes on positive psychology, and it's that we teach our kids to be helpless, learned helplessness.
Yeah.
And instead of allowing them with safety nets to experience failure and then build resilience.
It's interesting. You look at the progression of what you said. I said helicopter, we said hovercraft, and then we've now gotten to that place of forget it. We're going to take it all out, and we're just going to snowplow them into where we want to give them this clarity. But I have a 22-year-old son, and you're talking about a toddler.
Right.
I'm trying to undo some of all that other stuff he's not going to get every job, and it's painful. It's painful.
Well, because I think our children are not our products either.
No.
I think learning that children are their own human beings was tough to learn.
It is.
Especially when they were squirrely or they didn't put the bows in their hair
or made poor decisions.
or did dumb stuff.
They're not in the same classification.
And so in all of this discussion about recovery and substance use, I think the key, and tell me what you all think, at what point in time do I have a problem? How do I know when I have a problem?
That's a great question.
Mine was easy. I went the orange jumpsuit
for the second time, and that is not a good color on anybody.
But do you know what? Waking up in that cell, not feeling the best, in an orange jumpsuit, don't remember how I got in that, I actually felt this relief. I thought, I know where I am. I know what I'm doing for the next so many hours. And my next worry was, did I hurt anybody? And I was petrified to ask, but somebody was looking out for me because I didn't. But I got caught in time.
Was able to do some volunteer work at a local prison. And I'm sitting next to an inmate, and he told me, he said, if I could go back and change one day in my life, he said, would I go and change the day I committed my crime? Or would I go back and change when I started to veer off course? He said, but the problem is, he says, I don't know what day I started to veer off.
Yeah. The earlier we can intervene is always going to be better, but there has to be some kind of collaboration in order to do so. And addicts and alcoholics have an amazing way of manipulating the people around them to keep them separate and keep them what we call, I'm going to, isolate this parent to be the right one and this one to be trying to be the other guy and trying to actually. But you said, so when do we do it? As soon as possible, as soon as we know. I would much rather deal with a family who comes to me and says, we just didn't know what to do, so we did everything. Instead of we didn't know what to do, so we
Did nothing. Yeah.
One of the issues that I struggle with all the time is I deal with a lot of youth.
Yeah.
And I get all the time, I'm like, your child is drinking. And yes, he's in high school, he's drinking and he's smoking. And he tells me he's really sad and doesn't feel good. And the parents are like, look at this child. He's a football player. He's so handsome. What is wrong? You have everything. We love you. Your family is supportive. And the kid is like, do you hear that a lot in your folks in recovery?
Well, I was just going to say, you asked me, I was very young, and I was a Division I full ride scholarship athlete who played on the United States American softball team. And I was in full blown disease mode, addiction. And so we're all those things.
And
Yeah. And so that stigma we talked about, but those were things I did, not who I was. Finding who I was the most important part of my journey.
That's a great point.
It really is. I sought for performance love. I didn't know that love came without performing and being the best.
They could just love you because you were a cool person. As
We love the fan song.
Or you can love me because I showed us today. Love me for. But I didn't realize that, and that has more to do now with how parenting my child differently. My parents did an amazing job. They were amazing, always there, always showed up. It doesn't matter what I wanted or thought I wanted. I didn't know what I wanted. So when we talk about lack of discrimination with regard to this disease, it doesn't matter where you're from, how much you make, what you look like, whether you perform or you don't perform. The fact of the matter is we have to find acceptance and love.
Yeah. Based on your experience in the field, do you find that one of the discussions is always, do you have a substance abuse issue? Or is the substance abuse issue a function of anxiety, depression, and other things that are going on in the world? What do you, hence the co-occurring disorder base of substance abuse treatment in today's world?
I think we have to stop trying to figure out the why, and deal with what is. Yes, substance abuse and using can be a trauma response. It can be a response to
Numb would escape.
exactly.
If I feel up is okay.
Yeah. So all of those things, but the figuring out why and when and all that kind of stuff is here's where we're at today. Let's dig in enough and get you into some kind of structured environment to get your mind and your body safe and clear. And then we refer out to these amazing places.
First things first.
Yeah, amazing places to do that amount of work to unpack that bag.
I think it's interesting, and I don't want to get too technical here, but what are the impacts that alcohol specifically, let's just talk about alcohol for a moment, have on your brains? What is it doing to us that is having this negative impact? And I only have 2 glasses of wine at night. Okay, and so at what point what are we doing to our brains? Well,
For one, it's a depressant. People still don't understand. They're using it to escape, but it's a depressant. It's pushing them down further, and they don't even know it. And it's funny how you said 2 glasses. My father, when he came over work, only had 1 drink at the end of the day.
Right.
But it took 2 hands to lift that thing up. And he never quite let it get down to the bottom before he filled it back up. But buddy, he only had 1 per day.
Oh my gosh. Yeah. We've talked about that before. I think COVID did not do any of us.
Oh, goodness.
Yeah, we have to make.
I think it was always there. I think it just brought a lot of the stuff to the forefront because it was so
I agree with
traumatizing.
That. Yeah, because people, on the different social media platforms, including LinkedIn, started to talk, which is normally primarily a business, but they started to talk about this and people that they were seeing that were really struggling and all, it just became a little bit more accepted. And I think that's the biggest hurdle if we can continue to beat that down and for people to understand this isn't something to be ashamed of. This is a disease. And my mum was an alcoholic, and she actually died of an overdose because she was also habitual, drugs as well. Which actually, it was morphine. I even know they came in tablet form because I focused on wine. But my dad would think that she was, he would say, was she schizophrenic? And until I got into recovery, I understand now she was having a psychotic break because she had the strength of Goth, and she was, you know, when she was off, when she was calm and back to herself, she was wonderful. But none of us, it's kind of, I don't like the word ignorance, but it's a lack of education, lack of awareness. Yeah.
It really is.
So just do
More denial.
la 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 la.
It's new. It's not me.
Yeah. Even when she passed, I was asked to tell everybody she had an aneurysm.
Oh, aneurysm.
Aneurysm. Yeah, aneurysm.
One of those.
Again, stigma.
Stigma.
How does that make us look? A woman just passed.
Exactly.
Can I shift gears a little bit and talk about one of the questions I have from folks is I'm scared to death to go through detox. Or I tried it at home. I tried it 30 times at home. And after a day or two, I just can't do it. I'm sweaty and I'm, you know, shaky and I'm
going to die.
I'm going to die and I have to have a drink. What are the myths around detoxification, specifically at Coastal Oaks, but really for medical assisted treatment in detox now?
Well, so the myth is, with drugs in particular are that you feel like you're going to die.
Right.
With alcohol withdrawal, you can die.
Right.
You know, the seizures are chronic and most people have to be hospitalized very quickly. So that's to me, that was the big one I learned as well, kind of working in recovery.
But I don't want to go to treatment because I'm scared of detox. I've heard bugs are crawling all over me and it's going to scare me.
No, I think that's again a myth in that that's what you feel like. However, what's happening is your body's trying to rid itself of the chemicals and get back to a baseline and normal state and, you know, your chemical balance.
But isn't it also true that when I am in a detox program, I'm not left to just lay there and feel horrible?
No, that's what I was going to and segue into is because we are, like, every patient that comes to us is managed by a physician, a nurse practitioner. We have a medical team. And during detox, they're given what we call a taper, a detox protocol taper, which is medications that have been proven over many years to work best for somebody who might be 55. Everything is very individualized.
Okay.
55-year-old male, 210 pounds, 6 foot, 6 feet tall, drinking, you know, a half a pint a day, lacing it with maybe some beer and cocaine a little bit over here. So everything is very individualized. The physicians and providers then pick and choose from the detox protocol that's in place. So the person, one, is detoxed safely, as slowly as necessary, is not over-medicated, but is not under-medicated, and is comfortable, and most importantly, doesn't have to be shipped off to the emergency room for fear of seizure, spikes in blood sugars. So having that nursing staff 24/7 and medical staff, then somebody who comes in might be on opiates and they're scared to death to be what we call dope sick.
Okay.
We have medications that offset that sickness, that feeling of sickness. So we monitor them every 15 minutes with vital signs. So you're in a safe, secure setting with medical staff to oversee every step of the way, and the medications are all driven by individual need.
Yeah, a competent, caring environment. I guess that.
Yeah.
I think this has been absolutely awe-inspiring and very informational, caring, compassionate, and pretty direct. So Lisa and Victoria, it's really, I really appreciate your time. It's wonderful.
Yes.
And it gives us insight for all of us on how to actually mind your health. So thank you.
Thank you.
Mind your health. You got to mind your health.